So here we are using the LightForce FXI, and the beauty of this technology is that you can actually make the treatment very specific to the patient by selecting the protocols. The technology in this laser really makes that quite easy for you. It's got built in what they refer to as influence technology, and it's really simple. At the touch of the screen, I would go to protocols, and it allows me to select the patient's height, body type, and even skin color. Once I've chosen those, I go to next, and then I go to the area that I'm going to treat. For this particular patient, we're going to treat the TMJ, the temporomandibular joint, on the left side. So now that we've isolated that area, I'll go to the next screen, and it's going to lay out the treatment for me pretty much. Time, the power or wattage, and even down to the pulse rate. And all I have to do is make modifications here if I choose to, depending on the patient, if they're in acute pain or if it's chronic pain, and then we proceed with the treatment. Now I like to use the applicator head that collimates or really does make that laser beam very narrow. So I'll use the smaller of the applicator attachments. Stand by. And then I'll come right into the TMJ joint, and I'll proceed with my treatment. Now, throughout the treatment, sometimes I'll even ask the patient to go through some motions with the jaw. So go ahead and open just halfway for me and close that. And do that for me 3 times. And oftentimes what the patient will report to feeling is just a warming sensation. May get a little bit toasty, but it doesn't burn, doesn't get too hot throughout the entire treatment. Now this particular treatment, depending on the patient and their symptoms, could last 2 to 3 minutes. Go ahead and open up 3 times for me. And opening and closing the jaw, I think, does help get that laser deeper into the joint. It also helps activate those muscles around the TMJ, and it helps, I think, increase blood flow as that laser gets in there a little bit deeper into the joint. And open up 2 more times for me. And close it and just relax there. Now the laser treatment does not replace what also I may do in my office for the patient. Chiropractic adjustments, I may do some soft tissue work into the neck and shoulder region to try to clear out some of those trigger points, try to do some soft tissue work to increase elasticity of the muscles in conjunction with the chiropractic manipulations. I really do think the laser is a very valuable complement to my treatment here in the office.